Good morning, everyone. Welcome back to Breakfast Television. We're live on location this morning at Health Plus Family Vision, getting our eyes all checked out and making sure that they're healthy and good to go. So I have my old glasses here from university that I showed off earlier, getting a little flack that these weren't quite dorky enough, but these are very circa 99. I need to update my frames, and so we're going through the process here. And this is the second step, I believe, in the pre-test. And what are we doing here today, Gord?
Well, we're going to be taking some pictures of the back of your eye.
Okay.
Yeah.
It's photo shoot time.
Absolutely.
And Wendy is the photographer, so I'll have a seat here.
All right, Jill. So I need you to put your chin in the rest and your forehead up against the bar there again, please.
Okay.
Now, right in front of you, you're going to see an orange light. So I'll get you to look right at that for me. And there's a floating green light over here to your left. Now look at that, please.
See it.
Perfect. Now you're going to see a bright flash. Wonderful.
No problem.
Let's do your left eye next.
Okay.
Same thing.
It's my best
light.
side.
Now the green light's floating over here.
Got it.
Okay, bright flash. And that's it. You can sit back.
That's the easiest photo shoot I've done so far. Perfect. So then what we do is Dr. Osiowy is going to tell us what exactly we're going to be seeing here. So that we have an actual picture of my eye. So you can actually determine and pinpoint different health problems based on this procedure right here. Is that right?
That's correct.
Okay.
So this is your eye. This is your optic nerve, which is a bundle of all the nerve information collecting all the visual input from the rest of the retina. Down the center of the optic nerve is where the blood vessels come in, bringing the blood flow into the back of the eye. So the blood vessels are a continuation of the rest of the body's vascular system. So we are able to assess if there's problems with blood pressure and cholesterol, diabetes.
Okay.
Everything's very healthy in the blood vessel pattern here.
What about this cloudy bit?
And the little whitish sort of look here is actually a very healthy view. It's reflections off of your wet, young retina, so that's normal.
Okay.
And then this little red dark spot, it's darker because there's more nutrition, more blood flow behind the area called the macula, and that's where all the cones are concentrated,
Okay.
and that's where all your detail vision is. So
let's go through a couple really quickly. We'll go through some unhealthy eyes.
sure.
30 seconds.
And the different things that you can tell. So what is this?
This here shows glaucoma. The optic nerve is very pale and almost looks like it's glowing, and it's typical, or it's caused by eye pressure that's too high for that individual's eye. A lot of people, and with glaucoma, that can happen actually almost at any age. So that is checked right from early age general assessment when you're in for an eye exam. This is a type of macular degeneration. It's more of an age-related problem, but this is a form of dry macular degeneration.
Okay, and last but not least,
This one is always very interesting. This is actually a
Spectacular
broken blood
looking.
vessel from a person with high blood pressure.
and what would that show then?
Basically, when the blood bursts there, the person can lose sight, and then quite often when we check their pressure, it's very, very high pressure.
Okay.
And then they'll have to see their medical doctor to get that all corrected.
Which is why it's important to have a regular eye exam, guys. And I believe that I have a contest I need to be entering, possibly as Bill Jelland. Look for it.